My guest today is Dr. Shawn Baker. Dr. Baker is an orthopedic surgeon, a former rugby player, powerlifter, and world record holder in indoor rowing, as well as a carnivore diet advocate. Dr. Shawn, thanks so much for taking the time today.
Hey, Mark, thank you. Thanks for having me on.
Well, listen, no problem. I started following you a few years ago on Twitter, the athletic feats, the world records, and the Concept 2 rower. Can we start things off here by maybe you talking a little bit more about your athletic background?
Yeah, so I've had kind of a mix of a number of different sports over the years. I actually started out as a cross-country runner in high school, and it was very, very thin. I wasn't very good at it, never really enjoyed it very much. Then I kind of transitioned into, a little bit of weightlifting as a kid, got a little size on. By the time I got through college, I took up rugby, and I was playing, I remember in medical school, actually, and I ended up being fairly decent at it. Got recruited to go to New Zealand to play for a team in one of their premier leagues, and so I did that for a while. Came back, played with on a bunch of representative teams on the U.S. Then I got into powerlifting, and I did that for off and on for about 2 decades. I ended up setting some records in the deadlift. I was tall with long arms and long legs, so I wasn't much of a bench presser or a squatter, but I could deadlift pretty decent. So I got up to a 350 kilo deadlift.
Nice.
That's 772 pounds for people that can't do the conversion. But and that was all drug-free stuff. I've always been a drug-free athlete. And then I went from powerlifting, and then I did some of the strongman stuff. I did that for a couple of years, had fun with that. I competed, for about 2 years and had a good time. Did reasonably well in that. But just, I'm just not big enough for that sport. I was about 6'5", 280, but, I think, these days you have to be another 50 to 70 pounds bigger to succeed at that. And
yeah,
again,
incredible.
there's an issue of a lot of drug usage, which I wasn't willing to do. So I left strongman. I took up throwing. I got involved in the Highland Games. I did that for about 6 or 7 years. I won a Masters World Championships in that. It's the Highland Games, for those that don't know, is just a sport where we do a lot of, it's kind of shot put type events with natural stones, weights that you throw that are up to 56 pounds with one hand, throwing cabers and hammers and stuff like that. So that's a fun sport. I had no throwing background whatsoever, and I think the only thing that allowed me to do well was just that I was, still strong and athletic, and had a pretty good work ethic. I trained with a number of world champions in the sport, so that helped. And I dabbled a little bit in track and field. I trained with a guy named John Godina, who was a multi-time world champion athlete in the shot put and discus, and so he was a good one to train with. And then I guess in my mid 40s, after I got done, doing all the heavy type stuff, I kind of got into more of an endurance, based activity. So I took up the Concept 2 rower. I've been doing that about 3.5 years now. I turned 51 next week, and I've been able to break a bunch of the U.S. records and then several of the world records on that for more of the sprint type distances. And so
that's incredible.
That's where my focus is currently. So hopefully I'm primed to break some more world records on it. Hopefully in the next few weeks to month or so. I think that's where I'm at right now.
And at what point did you evolve into, back in when you were playing these sports, was it more of a traditional diet? And then at what point did you start evolving into whether it was low carb, keto, or now in terms of, kind of all meat, zero carb diet?
Yeah. So in my mid 40s, I was still training really hard. I mistakenly believed that as long as you trained as hard as, train hard, you could eat whatever you want. And I found that not to be true after I got into my 40s, basically, and I started developing signs of, metabolic syndrome. I had weight on that wasn't coming off. I had, I remember when I turned 40, I said, I'm gonna get lean, get some ab, be a little vain and get some ab muscle, but it never happened because I never changed my diet.
Gotcha.
That didn't happen until I got into my almost to 50. But back then I was, my blood pressure was a little high. I was probably developing sleep apnea. I was still about 280 pounds back then, so I was still a big guy. I wasn't, no one would call me obese, but I wasn't, really lean either. Just a big, strong guy. Energy was low, having trouble, with sleeping well, stuff like that. So that's when I decided to look into diet. Prior to that, I kind of just was thinking that, you can eat whatever you want as long as you train hard. So I played with, the first thing I did was I went on a real kind of low calorie diet, a lot of fruits and vegetables, a little bit of fish. It was almost kind of a vegetarianish diet. And I ramped up my training. Some days I was training 3 times a week. I remember I was doing just a ton of jumping rope, thousands of jump ropes a day with workouts, and just cutting my calories massively. And I lost weight for sure. I got a little leaner, but that, clearly wasn't sustainable for me. It wasn't enjoyable. I was pretty grouchy guy at that point.
But say like recovery wise and things like that.
Yeah. Yeah. I mean, it's, that hypocaloric, that spending a lot of time in a sort of calorie deficit is not a long-term prescription for success. And so I transitioned away from that into more of a paleo diet. I did that for about a year. I had fun with that. Then I started reading more about the kind of the low carb, literature, read some of the books out there, experiment with that, continued to have more success, transitioned to keto, which I did for about 2 years and did it pretty successfully. And while I was doing that, I noticed, significant improvements in, clinical signs of health. My blood pressure normalized, joints started feeling better, things like that. Mood got better, energy was better. And then finally I just transitioned over to a fully carnivorous diet and just noted, even more improvements. And that's kind of where I've been now. I've been doing, this fully carnivorous diet now just for over a year. I passed that mark this December. And so I'm in my second year of that now, doing very well with it.
Wow, and that's effectively all meat, virtually zero carbohydrate. What else is? Can you kind of roughly give us an idea of what's in the diet for you?
Yeah, I mean, the diet in general is, it's heavily, meat based. So it's usually some sort of, most people it's beef, but a lot of people will do lamb. That some people will add chicken, fish. I occasionally have a little seafood, typically shrimp. The farther I've gone, when I first started, I had a little more variety. I would rotate in quite a bit of salmon and shrimp and a little more dairy and, stuff like that. But as I've gotten farther and farther into it, it seems counterintuitive, but the more you do it, you just sort of, your desire for just one thing kind of increases, which I think a lot of people that, they see that from the outside and they think it just sounds utterly bizarre. And it would to me too if you had asked me a couple of years ago. But really what happens is I think you just find what works really well from you, and then you lose all these cravings for other foods, and you just feel good. And so that's, I preference feeling good and performing well over the desire to be entertained by my food. I think food is, a lot of us do it for entertainment purposes, and that has its possibly its negative consequences. But yeah, that's pretty much it. I mean, you can put a little seasoning on your food if you like it that way. Eggs are fine. A lot of people, eat eggs with this.
The classic like steak and eggs breakfast. I know that was in the bodybuilding circles there, circa 50s, 60s. There was it Vince Aranda and the likes.
That's very similar to what this is. A lot of steak, a lot of eggs for a lot of people. And then, a little bit of dairy. Some people have trouble with dairy, so you just have to kind of play that by ear and see how it affects you. But it's a very effective way at eliminating variables. I think a lot of people, much of what we consider, aging or disease is probably, signs of metabolic syndrome. And I think those things are affected by, our diet, clearly. I think our diet is impacting our health significantly, and if nothing else, this is a very good diet, a very good elimination diet to sort out those issues. When you reduce your food to just one item, it becomes pretty clear. Once you reintroduce other foods, what their impact is on you. So it's a nice thing about it. And there's a lot of people that do this for a couple months and then they'll add back in something that they tolerate and do well. There's other people that feel so good this way they just stay this way, and that's kind of where I'm at right now. As long as I'm making progress and doing well, I'm going to stick to what I'm doing. I'm not wedded to this for the rest of my life, but it's one of those things where you just kind of do what works, and as long as it's working, you don't need to change things.
100%. And I mean, if we think mechanisms, I mean, obviously, increasing protein intake for a lot of people, potentially, like you mentioned, eliminating a lot of the processed foods, got to just be a huge win as well for this type of eating pattern. A massive increase in micronutrients with red meat intake as well. And for a lot of people, obviously, I think achieving a caloric reduction with this would be another potential mechanism. Is there Do you think all of the above are kind of contributing? What are your thoughts on some of the underlying reasons why this can help so many people?
Yeah, Mark, I think certainly any diet where you get rid of the garbage, and we can argue about what the garbage is, but I think clearly heavily sugared, heavily refined, refined products that contain probably a lot of vegetable oils is not good for anybody. So whether you go on a vegetarian or vegan diet and eliminate that stuff, or a paleo diet, most people are going to notice a positive outcome from that alone. So I think that's part of it. I think, again, meat is I'm not one that talks about superfoods, but meat is really a quality, it's a quality,
superfood. There you go. Yeah, it always gets left out from the superfood list, doesn't it?
Well, it does. It's been, unfortunately, it's been demonized unfairly, and I think one of the things that I am seeing, because we have this carnivore community growing, and what we're seeing is, not what we're being told about meat, where it causes diabetes and high blood pressure and all these other things. We're seeing the exact opposite happening. So when we see people that just restrict their diet to just meat, generally they all get healthier for the vast majority of them. Their blood pressure normalizes, their hemoglobin A1C normalizes, their inflammatory markers normalize, their clinical symptoms, which is in my mind the most important thing. Those things all get better, and so. I think it's very good nutrition. I think not to oversimplify things, but I think we overcomplicate nutrition sometimes. I think when we look at, what you and I and every other human on the planet is made out of, we're just made out of animal tissue. I mean, we're animal fat and animal protein by the most part, with some, few salts and micronutrients thrown in. But I mean, you pretty much most efficient way to get that, in my view, is just eat the same thing. You can get some of that stuff from plants, but it's they tend to be less bioavailable. It comes with sometimes some chemicals that don't do as well. Some of the things like fiber and anti-nutrients, they're just harder to digest. And so I think a lot of people that take this up, until you do it, it's hard to experience that. But I think if you've been following me on Twitter, you're seeing what I see every day, just hundreds and hundreds of people constantly saying how much better their health has gotten. And I'm in contact with literally thousands of them.
Yeah, I mean,
so it's interesting and deserves further study, and that's what I'm attempting to try to facilitate.
It's really interesting because, I know going back 100 years almost, Vilmer Stefansson, who spent so much time living up with the Inuit in Canada, and, they're eating, 70-80% fat, mainly from things like seal and caribou, and they totally prize the fat, but, he found no incidence of really heart disease or diabetes, and he actually spent a year in a hospital in New York eating nothing but meat. And I think I had Nina Teicholz on the show last year, and she'd mentioned they'd produced something like maybe 6 papers out of this, which never really made it into the mainstream. But it's fascinating stuff. And if we keep on this sort of evolutionary perspective, are there any traditional populations who ate nothing but meat, or majority meat? I think Maasai and the Inuit are sort of the first that come to mind, but.
Yeah, there's other polar groups. You look at like the Sami. Some of the I think that I can't remember the names of. There's some up in Siberia and Russia and all these Arctic where they don't really have a choice. But they've done well. The Maasai. There's some other than Nilotic African people that primarily ate that way. I think like the Watusi and some of these other folks were. Meat was a huge part of their diet. The Gauchos down in Argentina are another group. The Plains Indians, traditionally they had a heavily, buffalo-based diet. The Cheyenne Indians in particular. Obviously, probably some of the the Cree, up in Canada. They obviously, spent a lot of their time eating that stuff. It's not that they were 100% meat-based, but I think these people largely were. One of the criticisms that I've seen is, a lot of when they talk about the Inuit, they talk about their life expectancy. They live maybe to 60 or 70, and there's people that live longer than them. But one of the things that people forget is that when we compare their population and their standard of living and their socioeconomic status, and that's one of the biggest predictors of life expectancy. If you live in a rich country, you're going to live longer. If you live in affluent areas of Canada, if you live in Monaco or Switzerland, life expectancy is just good. That's the thing. But when you take these people that are living on the fringes of society, like the Inuit are, and you compare them to equally, people in their same social situation, like people in other countries like parts of Africa or Asia, Bangladesh, stuff like that, the Inuit do far better with life expectancy. So I know one of the knock is they live to 60 or 70, but again, you have to take in those other things as well.
Absolutely. And if someone's about to kick off on a zero-carb, all-meat diet, are there any micronutrient factors, or from your point of view, what would a meat-only diet theoretically maybe predispose someone to any kind of deficiencies? What have your observations been?
Yeah, I think the biggest thing we see is probably mineral issues with salts and electrolytes. I think the same thing when people go on a ketogenic diet. There's a shift in how well our kidneys handle electrolytes. You kind of lose some of that, and so I think initially some people, until they reach homeostasis, may need to supplement with salts. Not everybody has to do that. I think again, depending on your activity levels. As someone who exercises quite a bit, I tend to liberally use salt with that. People that have underlying nutrient deficiencies, and I would argue that even obesity is basically just malnutrition. It's people that are
for sure
consuming adequate calories, but they're undernourished as far as the nutrients they need. And so I think a lot of people come into this diet or any other diet starting off, with in a deep hole as far as nutrition is concerned. And so some people might find that eating organ meats and some supplements can be helpful initially. I think long term though, and what I'm seeing is most people end up not needing to continue those things. And I think one of the things that we kind of know about, it's a little bit in the literature, but we don't really recognize, is that what everybody looks at as the RDA requirements are skewed based on a population that eats carbohydrates. And we know that carbohydrate metabolism, a lot of the cofactors that are required to make that system run, are in the diet. And when you're not utilizing a carbohydrate metabolism, your requirements for certain nutrients just go down. Things like manganese and magnesium come to mind in particular. Possibly vitamin D has a role in there too. Vitamin C, which people ask me why I don't have scurvy, because on the paper meat has none, basically none. Although it's kind of interesting, the USDA never tested meat for vitamin C; they just assumed it was none. And independent labs basically have shown that, and this is something that Amber O'Hearn, who goes by Keto Carnivore on Twitter, has kind of unearthed, is that meat, about a pound of meat has about 10 milligrams of vitamin C, and that's enough to
keep you going.
It's enough to keep you out of having scurvy. And so I'm eating much more than that, and so I don't have any issue with that. But I think like I said, if you have if you had a gastric bypass, perhaps there's some people that they come to a diet after a gastric bypass, and they're going to have difficulties absorbing nutrients, so you might have to supplement in that situation.
Yeah, I had Dr. James D. Nicolantonio on last year and talking all about salt, and of course, processed diets being such a big factor in the excessive intake of processed salt in folks and increasing the requirements for a lot of micronutrients. So it's interesting what you said. If we're cutting out all these processed foods, and a lot of these requirements could definitely be potentially shifting downwards, right?
Well, I think that's what we're finding. That's what makes sense to me, because I like I said, having seen thousands of these people that have done this for long periods of time, they're not getting these nutrient deficiencies, and so you have to be able to explain that explanation. If I wasn't hitting my requirements for vitamin C, then I would have scurvy, and certainly I would have it long before a year was up. What happened with the sailors that everybody looks at, they were eating dried meats and they were eating a bunch of carbohydrate, hardtack is what they would call that. And so that was their diet. And so they probably increased their requirement for vitamin C, and, the dried meat wasn't supplying it. So you have to have fresh meat. It doesn't have to be freshly killed. It just has to be basically not dried. And so that's where you get around developing scurvy with that.
For sure. And I think another one for people listening in who are, trying to make a change, improve their health, maybe even on the athletic side, is the whole cholesterol, saturated fat story, obviously increasing their animal protein intake. Now, we know a lot of this has been debunked, but what would how would you inform folks when you say, hey, we're going to go nothing but red meat for a month? What have you noticed in terms of impacts on lipid panels or saturated fat intake?
Yeah, I think that's very, that is interesting, because for a long time we've sort of, equated red meat, saturated fat, and cholesterol as a driver of, high cholesterol in the bloodstream, which was then associated with heart disease. Again, as we're seeing a number of these studies coming out now showing that association really hasn't held up well, and there's better markers for disease. If you're looking at lipids, things like triglycerides and HDL cholesterol, probably better markers than LDL and total cholesterol. So you have to take it in context. The very interesting thing about this is a guy named Dave Feldman, also on Twitter. He's doing these experiments, and he did just, in fact, yesterday, he showed that he could drop his LDL by over 100 points in a week, which, just by, changing the amount of calories in his diet, basically. So what we're seeing is, those markers for disease are highly, highly dynamic. And so if you go to your doctor and your LDL cholesterol is 180, and he says, hey, we need to put you on a statin, you could go in a week later and it could be 102. And he would say, good job, you're doing great. So the whole cholesterol is tied to disease is probably, one, it's associational, they were poor association, but two, it's so incredibly variable that you could basically make your cholesterol be whatever you want based on what you've eaten in the last couple of days, which I think to me is, it's groundbreaking. I mean, I think they've known about the dynamic nature of cholesterol for many years, but it's not really come to light. People have never paid any attention to that, and so we've had this sort of paradigm where, you go to your doctor, your cholesterol is high, he says, go on a low-fat diet or we're going to give you this drug. And what's truly happening is, it's just what you did in the last couple of days which affects that cholesterol, and it doesn't stay the same day in and day out. So it's kind of a shame. We have, there are, as many people have heart attacks with normal cholesterol as anyone else. So it's
low cholesterol for that matter as well, as you mentioned. I mean, low cholesterol levels, just as many heart attacks. It's and I think places like Spain as well have the highest red meat intake in Europe, and they've got the least amount of cardiovascular disease. Same with in Asia. So as you mentioned, I mean, it's just such a associate bias there with just red meat consumption and cardiovascular health. Now, what about fiber? That's another one that I think people are going to ask about, which is fiber intake, the microbiome, such a hot topic, gut microbiota. How does zero-carb meat-only diet impact the gut?
Yeah, so I think you have to look at what fiber is supposed to do. There's a number of sort of benefits that are attributed to fiber. And I think one of them is that it can potentially lower your cholesterol. There's been some studies showing that cellular fiber may have an impact in lowering cholesterol. That's probably true to some degree, but again, in the context of what does cholesterol even mean? What does lower cholesterol do for you? I'm not convinced that makes much of a difference. So I don't think there's really any great benefit for eating fiber in that case. The other benefit is if you eat fiber, with like, let's use an apple as an example. If you eat an apple by itself, you're going to get less of a glucose spike than if you drank apple juice. So the fiber can kind of mitigate that glucose spike. In the context of a zero-carb diet, where you're taking in basically no sugar, again, that's a pointless benefit. The other thing is people talk about, fiber helping regulate, your bowel function. And what I will tell you is the people that have done this for, several months or more will almost universally tell you that their bowel function and their digestion is the best it's ever been in their life. They don't have any more bloating or gas or constipation or anything like that. It just runs well. I mean, I haven't had fiber in over a year, and I have a regular, easy bowel movement pretty much every day without difficulty. There's been some studies out there that have been shown that people that have chronic constipation, that will improve dramatically on a zero fiber diet. There are studies out there that looked at colonoscopies on patients that they compared fiber in the diet, and they found that people with the greatest amount of fiber had the greatest number of diverticula. Diverticula are what predispose you to a condition called diverticulitis, and so I don't think that's really clear on that. The other thing is about the microbiome. A lot of people talk about you need to have fiber so that the bacteria in your gut will not eat mucus and predispose you to injury due to bacteria. Now, first of all, I think we are far, far away from determining what actually is a healthy microbiome. I don't think you can prescribe someone's health or describe someone's health strictly based on their microbiome. I think that is, we just don't know enough about that yet. But one of the things that many people will note with fiber, if you put somebody on a high fiber diet, a lot of people will experience gastrointestinal distress, bloating, pain, cramping, and all those things. And one of the reasons that is because there's a lot of people that believe that fiber is actually pro-inflammatory to the lining of the gut. You see people with ulcerative colitis, Crohn's disease, and irritable bowel syndrome that when you dramatically drop their fiber intake, their gastrointestinal health improves tremendously. And so one of the things about mucus, if we look at mucus production in our body, it is there to protect delicate surfaces. Like if you look at it in the lungs, first day, if you're a smoker or you're exposed to a lot of pollution or you get a respiratory virus, you're going to produce a lot of mucus in your lungs. That's because the lung is trying to protect its surfaces, and so it produces mucus. The same thing is happening in the gastrointestinal tract. I think fiber is fairly irritating to many people, and so what we're doing is we're producing mucus to kind of protect the gastrointestinal tract from the fiber. And so, so the theory goes that if you eat more fiber, you're going to make more bacteria that won't eat your mucus. Well, you can just say, why don't I eat the fiber, and then I don't need as much mucus, and the bacteria become irrelevant. And I think I've seen some people that have submitted their microbiome results on a zero-carb diet, and what I've seen so far, and again, it's only a few cases, but it's been basically a healthy, diverse microbiome. And so I don't. Again, I think it's context dependent. I think fiber, if your diet is, high in, processed refined grains and sugar, then fiber is probably, in that context, beneficial. But I think in the context of an all meat diet, it's probably of minimal to no benefit.
Yeah, it's such an interesting topic. I mean, I see a lot of patients with digestive dysfunction and irritable bowel syndrome, and you're right in the sense that when we trim the diet, when we reduce fiber for these folks, I mean the symptoms get a lot better. Definitely overweight, obese, a lot of abdominal adiposity. Same idea. I mean, this notion, we kind of use that reductionist approach of if again, a lot of these studies in the Maasai and whatnot have such high fiber intakes that we associate the fact that their microbiome is so great because of simply just the fiber versus the lack of all that other processed food. So I'm amazed at how trimming can be really effective. So I was just curious to see what you've been seeing. So that's interesting. Now I do see folks, if they trim for too long, though, they tend to experience some difficulties. Do you think that's because they're kind of halfway between, a really, all meat, zero carb, no processed food diet versus, where they might still include some in their diet?
I think it's again, I think there are a number of reasons why certain foods affect us. We like to talk about phytonutrients and all the wonderful chemicals and polyphenols and other things that are in plants, but then we sort of don't talk about the oxalates and the salicylates and the cyanides and some of the other stuff that may have a negative impact on people. It's not to say that it affects everyone. What I think is that we probably, if we go back evolution, to taking an evolutionary approach, I think at some point when humans sort of diverged on the genetic, or the evolutionary tree away from, the other animals that became, the chimpanzees and the other, apes and stuff like that, we developed the capacity to, we learned how to hunt. We got much better at hunting. We depended on, animal protein, animal fat for most of our diet. Our anatomy changed significantly. If we look at our capacity just to throw, the reason humans can throw really well as compared to another primate is because we learned how to hunt. We learned how to throw things. Our brain size developed. Our gut got much smaller relative to a chimpanzee or an orangutan or another similar animal. Our colon shrank tremendously. So I think, there was periods of times where we heavily depended on animal protein, and it's very efficient. If you think about it, despite what sort of the propaganda is, that meat is really well digested by our digestive system. We're well set up to do that. Our gastric pH is 1.5. It ranges among the lowest of any animal on the planet. It's on par with other basically scavenger animals, things like hyenas and vultures that basically eat leftover meat. That's probably how humans started out. We probably, or maybe Australopithecus, these early animals that became humans later. We probably followed predators around, and when they got done eating, whatever they ate, when they made the big kill, we went in and ate up, cleaned up the scraps. And there's some pretty good evidence to show that. There's some researchers in Africa that have looked at that. They follow lions around and they've watched what they leave behind, and they find that they leave about 10 to 20 kilos of meat behind, which is quite a bit of meat, like on a zebra. So it's very plausible that an animal can come in there, and humans at that time probably went in there and scavenged that. And that's why we developed this really low pH, because we were probably exposed to a lot of pathogens. If meat's been sitting out for a while, obviously we know bacteria are going to land on there.
For sure.
So we've got to deal with that. So the animals, there's two classes of animals that do that: scavenger animals, and then rabbits. Rabbits eat their own feces, and so rabbits also have a low pH. But most of the other animals, even other primates, most chimpanzees and other apes, their pH tends to be about 3 to 4, whereas ours is 1.5. So we are heavily set up to be meat eaters. We can look at ileostomy patients, where you can look at what makes it, through the small intestine, and when you give those patients meat, it's almost completely absorbed. There's almost nothing left. And so, it's very good nutrition. And I think, like I said, I think our anatomy is well suited for that. And I think, we can get some nutrition out of eating plants. We've been doing that for 1,000 years. We're obviously omnivores. I mean, that was a survival strategy. It's, fortunately we retain that capacity. But I think that a lot of people find, there's only one way to find out is to do it. And I think the people that do it are finding this out, that they function very well on a highly carnivorous diet. And I think that's true for most people. It helps with health issues from what I've seen. And quite honestly, from an athletic standpoint, I know you're involved with the Canadian basketball stuff. And I think what I'm seeing more and more now, since I've gone out here and done this and been very public about it, I'm seeing a lot more athletes that are taking this up. And they're reporting to me that, they're seeing pretty significant strength gains. Their recovery is very good. Their just overall performance is getting better and better, which I think is very interesting. And I think it's, I think obviously there's some benefits from being fat adapted, as far as athletic performance and that stuff. But I think this goes a little bit beyond that. I think the, what's in meat, carnitin or carnicin, creatine, high quality protein, iron, all the other micronutrients which are highly bioavailable, I think results in just a better overall nutritional package. And obviously nutrition is very important in both health and in performance.
I mean, definitely. It's very well said in terms of just being a superfood, and the juices even containing lots of magnesium, and it's definitely something we emphasize. Grass-fed, wild sources as best we can at Canada Basketball. But if we circle back on your front, athletic performance-wise, how was the transition for you? Was it sort of seamless as you moved towards sort of zero-carb approach? Was there an adaptation period for you?
Yeah, I think that, like I said, I'd already been on a ketogenic diet for about 2 years. And so, I think for me, athletically, it took about 6 months to, really reap the benefits athletically on a ketogenic diet. I initially took a hit, then kind of, leveled out for a while. Then I started to make progress again. But when I went on a zero-carb diet, coming from a ketogenic background, I probably took another hit, which took me about 2 months athletically to recover from. And then I started noticing pretty dramatic improvements in strength. I've been, Mark, I've been doing this for almost 40 years.
For sure.
I'm not a rookie.
Yeah,
you get these newbie gains where anything you do is going to change. But I've been at it for 40 years, training hard, and
in a lot of different realms as well, right?
What's that?
In a lot of different areas as well, not just one.
Yeah, different sports. And so, I'm pretty meticulous in how I train. And I didn't really change my style of training at all. But I noted, I noted about an 8% increase in power production, which at the level I was already at is pretty significant. I don't take drugs, but from what I know people that take steroids tend to see a 10%, maybe even as high as a 15% improvement in their strength levels. And so for me to see an 8% increase, it was pretty significant in my view, and so it's allowed me to sort of jump ahead of my peers quite a bit.
Yeah, it's interesting too that a lot of the high intensity intervals have been shown, getting that glycogen stores down is a great way to facilitate a quicker adaptation to whether it's keto or obviously very low or zero carb approach would be beneficial. So sounds like it's been working for you as well.
Yeah, I think, one of the knocks is, people will say you have to have carbohydrates to do glycolytic stuff. And, I don't know how familiar you are with your athletes if they use the Concept 2 stuff. But, the distance I'm doing, typically 500 meters or so, that's about a minute, 15, for most people about a minute 30 if they're in fairly decent shape.
For sure. That's a good hockey really shift up here in Canada.
That's what's that?
So it's a good hockey shift up here in Canada.
Yeah, I mean that's a glycolytic. That's a very glycolytic time period. It's anaerobic glycolysis, but I mean it's you can use a lot of glycogen. And I'll do repeats where I'll do 100-meter sprints, all out, and I'll repeat them 20 times every 2 minutes, and do fine with that stuff. And so I think you just have to adapt to whatever. I think your body is able to adapt to that. It's not like I'm not making any glucose at all. Despite the fact that I'm not eating carbohydrates, I still have plenty of blood glucose. I still have glycogen. It's not like that doesn't happen. Your body will adapt to that. Now, I probably utilize more fat at a higher intensity than other people would. But once I hit at those top levels, I can tap into my glycogen, I think, just fine. I think that's what's clearly happening. But I do think that as you may, again, I don't know what your athletes are doing, but I think you'll find that people tend to use fat more often. It tends to beat them up a little less. I think there's, when you're running high levels of glucose all the time or high levels of glycogen, that's probably creating a little more oxidative stress, and I think it's a little more difficult to recover from. So I'm finding that my recovery is very good. And that's what other people are also finding on this, that their recovery is improved. And I think you just don't beat yourself up as much despite the fact that you're training hard.
Yeah, I mean, I definitely get the full gamut of folks who are doing ultra marathons and fully keto, fat adapted to highly glycolytic sports where carbohydrate consumption is pretty darn high. So if I could play devil's advocate here just for a minute, I'm sure a lot of sports scientists and researchers would wonder, have you attempted to maybe add some simple carbs right before any of your rowing attempts? What are the effects there? What do you think might happen if you did add just a little bit in before you actually train?
Sure, I did that stuff more when I was doing the ketogenic. I did different variations of the ketogenic diet. Cyclic ketogenic diet where I would do a carb load once a week. I would do the carb backloading, at night, and then I would do a targeted ketogenic diet where I would take in a little bit of simple carbs, often mixed with MCT. While I was doing that for a while, and I didn't notice it. I couldn't objectively get a real benefit from that. With the rowing machine, the concept too is very good at giving direct feedback.
Sure.
It's either you produce the wattage or you don't. And so I couldn't see a significant difference in that. The thing that I did notice, particularly with the big carb loads, is I just felt really bad. I think it was one of those things where you're transitioning, you're not using carbs, and then you're hitting your system with a big carb load, and I think that was for me upsetting to my system. I had a lot of gastrointestinal distress, and so I just didn't feel good. Initially I got excited. I remember when I first started doing the cyclic ketogenic diet, I was like, oh cool, I get to eat all this carbohydrate food, and it was pretty cool for about the first 2 weeks, and I started to dread it because it was just hard to eat, and I just didn't feel very good. So but I do think that probably the targeted approach is probably more interesting, and it may have an effect. Maybe I'll play with that again this year. I have been trying. I know you mentioned James Nicol Antonio recently, and I've been trying a little bit with salt loading. I know he's an advocate of that. So basically, I think the theory is you dose yourself with a amount of salt, a little teaspoon of salt before you train. Put some water in that potentially will expand your blood volume. Obviously expanded blood volume in the muscles is potentially a good thing, and so
for sure
I've been trying with that. So I'm not opposed to experimenting again. Right now, I'm still getting better and faster.
That's the name of the game. That's the one thing in performance is that it's the only thing that matters, right? So
it's the end result. And like I said yesterday, I hit another PR. I've hit PRs 3 days in a row. Like I said, I'm just interested to keep going, but I think there may be some merit in that. I think one of the issues is obviously carbohydrates can be a performance enhancer. Clearly, it has been for a lot of people. The question is how much, how often, when does it become a negative? We see a lot of athletes that they run on Gatorade, or they're just constantly putting this sugar in their mouth, and you see them, particularly when they retire. They get out of their sports, they have issues with that. I wonder.
Absolutely,
the other thing I wonder about is do these diets impact our tissue quality? We see injury rates. One thing would be interesting maybe you guys in Canada can look at that, is, there's something called advanced glycation end products, and I think that's a result of diet. And I think, a high sugar diet probably promotes that. And so I also think it probably affects the tissues and makes them more susceptible to injury. So it might be interesting to, scan people for that stuff. Maybe you can look at athletes that have had ACL injuries and, get an age score on them. There's skin autofluorescence readers that are out there that are available that I think give you a pretty good, reliable estimate of what your, how many advanced glycation end products you're dealing with in your tissues. And so that might be, just from academic curiosity, might be interesting to see comparing athletes that are injured versus non-injured athletes, or see if that predisposes them to injury.
Absolutely. I mean, that's definitely fascinating stuff. And, from the longevity front, I can attest as well. In clinic, guys in mid to late 30s, definitely 40s, 50s, whether they're trying to add more muscle or whether they're competing in more endurance bouts, if they're holding on to too much weight and their diet's higher and especially simple carbs and processed carbs or too many calories, I mean, definitely the tissue quality, the discomfort, the inflammation, these are things that are just through the roof. And, getting a reduction there almost all across the board always ends up with, superior outcomes in terms of inflammation, HA1Cs, all these types of things. So I'm curious, for you as an orthopedic surgeon, I mean, what types of surgeries would sort of dominate your day? I know obviously, type 2 diabetes is such a huge issue these days, foot amputations, or was it more joint specific stuff? What did you see?
Mark, I think, one of the reasons I went into orthopedics is because I felt it was a good field where you could make a direct impact. You could do a surgery, rid somebody of a disease, as compared to like primary care where you're constantly battling metabolic syndrome all day long. And the weapons you had to battle it with are just basically, certain medications, and then you kind of felt all the patients were non-compliant. But what I discovered as I got farther in my career in orthopedics is much of what I was battling was just the same stuff. I mean, it was just the musculoskeletal manifestations of metabolic disease. So I think arthritis, in many cases, is a problem with metabolic disease. I think it's systemic inflammation that causes joint dysfunction or tendinopathy and things like that. And I think one of the things we focus on in orthopedics are the biomechanics, but I think the biology and the inflammation and the nutrition probably precede that. So I think what's happening in an arthritic joint is you're having this underlying biology that's a problem, and I think that's coming largely from diet. And I think once that sort of compromise is there, then the mechanical factors take over. But I think what we do when you replace someone's knee, you treat the mechanical issue. You may be able to align the joint better. You've recovered the surface, but the biology is still there. And so what'll happen is, you may be the hero for the day because you fixed that one joint, but guess what's going to happen next year? They're going to come back for their other knee replacement, or
Gotcha.
their rotator cuff tear, and all these things that we commonly see. All this, tissue pathology, tendinitis, probably some of the peripheral neuropathies are probably originating as just manifestations of every other disease, like we see with diabetes and hypertension and dementia and, obesity. It's all probably circles back to the same thing. It's probably the same mechanism that underpins all these things. So I think if we don't address that, and that's one of the things that I regret about the field of orthopedics, is there's almost no research or guidance on adjusting diet to help with these conditions. It's almost if it doesn't exist. The first step is throw in a non-steroidal anti-inflammatory and physical therapy. Tell them to reduce their activity. You might tell them to lose weight, but there's no guidance on how to do that. And then it starts going into cortisone injections, arthroscopies, and then finally, bigger surgeries. And so the whole step one for almost everybody that comes in with a chronic orthopedic condition should be, what are you eating? How can you fix your diet? That's what I would, that's where I would start. And when I was doing that, I was eliminating, people that need, we would normally say you're going to have surgery. I've had people that were just no longer became surgical candidates because their symptoms went away, which I think is very powerful. I think the more people were to, investigate that, and whether it's an all-meat diet or a paleo diet or a low-carb diet or even a vegetarian diet, I think that would be the first line of defense that people should investigate. My personal experience shows that very low carbohydrate diets, and particularly an all-meat diet is one of the most effective tools in those type of situations.
Oh, well, it's a great message to be sounding out to everyone, and just that nutrition first approach for joint health and everything else is fantastic. And I've been sharing a lot of the studies and stuff that you've been putting out on Twitter, because I know a lot of the orthos and docs here around Toronto is definitely catching their attention. So I really appreciate you doing that. And of course, I want to respect your time here as well, Shawn. So last question for you, the question that I'm asking all the guests this season on the podcast is all about the fundamentals, or the big rocks as I like to call them. So with respect to a meat only or a zero carb diet, what's a piece of advice that you'd give folks, or maybe jumping into this?
Yeah, I think the biggest thing is, one, you have to eat enough. I think a lot of people that go into this, they tend to undereat. It's very satiating, and I think the people that I've seen that have not been able to stick with it, they just tend to undereat. And so what happens is they get cravings for other food, or they end up being fairly lethargic. Your system has to transition to a new source of fuel, basically. Anytime you change a diet, it takes your body a while to on-ramp and off-ramp different enzymes and different metabolic processes. So that takes a bit of time. So you have to ensure you're getting enough nutrition so you're not, suddenly wanting to binge on a bag of potato chips or something like that. The other thing is, you got to learn how to cook. I mean, I think that's a skill that everybody needs, regardless of what your diet is. If you learn how to make a good steak, you're going to enjoy it a lot better. Use some seasonings, use some different flavors, get a little variety at the beginning. That's what I did. Some people will find that doing a couple of days here and there is an easier way to do it. For some people, do better just taking all temptation out. It's kind of like looking at a person that's a smoker and saying, okay, we're going to have you quit smoking, but we want you to smoke 2 or 3 cigarettes a day. That strategy can be a losing strategy for a lot of people. So some people just do better, particularly if they're struggling with just really hard time, staying away from, food addictions. Basically, I think that's a real thing. I think people have food addictions. I think the food companies know that, and they design their foods so that they are very addictive. And so, so some people, just cold turkey works best. But I think you also have to pay attention to the other things. Get enough rest. Exercise, I think, is key. So I think you have to bring all those things into balance long term to make any particular diet successful.
Awesome, Shawn. Really appreciate you taking the time out today. Where can people keep up with all the great stuff you're putting out? Where can people jump into the program that you've just kickstarted as well?
Yeah, so my Twitter, I'm fairly active, S Baker MD. My Instagram has a lot of, I can kind of go a little longer posts there. So it's Shawn, SHAWN, Baker, BAKER, 1967. We started a Facebook group for World Carnivore Month, January. We've got a few thousand people participating. So the World Carnivore Month Facebook group, just type in World Carnivore Month, you'll find it. I've got a system where I'm training people. I'm training some people that are trying to get healthier and implement the diet. That's carnivoretrainingsystem.com. People that are participating in the study, because we're trying to get as much data as possible to try to legitimize this. So n=many.com and track-well.com is a tool we're using to collect data. So we're hoping to, turn these anecdotes into more formalized data, so we can start to present that and show what I'm seeing, which is basically people getting healthier, and their labs are coming back, basically pretty darn good overall. So that's my stuff right now.
Fantastic. Well, I'll definitely include all those links with the podcast summary in the show notes at drbubbs.com/podcast. Thanks again for coming on, Shawn. Thanks again for everyone.